Viruses transmitted through fecal-oral route. I'm Gangxin from Department of Microbiology and Immunology, Shantou University Medical College, China. Viruses transmitted by fecal-oral route include enteroviruses and viruses causing acute gastroenteritis. These viruses can infect humans through gastrointestinal GI tract. Please remember, the enteroviruses, despite its name, usually do not upset the GI tract. We have other viruses that actually cause gastroenteritis. This chapter will cover the following viruses: the enteroviruses, which belong to Picornaviridae, include poliovirus, Coxsackie virus A and B, echovirus, and enterovirus 68 to 71, etc. The viruses causing acute gastroenteritis include Reoviridae, rotavirus, Adenoviridae, enteric adenovirus, Calyciviridae, norovirus, and Astroviridae, astrovirus. The learning objectives of this chapter. At the end of this chapter, you should be able to 1. Describe the biological properties, for example, core, receptor binding site, no envelope, of enteroviruses, and discuss the relationship between these properties and the clinical findings. 2. List the clinical conditions caused by enteroviruses and viruses causing acute gastroenteritis. 3. Discuss the possibility of eradication of poliomyelitis. 4. Compare the pathogenicity of enteroviruses with that of viruses causing acute gastroenteritis. Let's start from enteroviruses. A case: a 12-year-old girl developed chest pain and difficulty breathing, which gradually worsened. She was seen in an emergency department where heart failure was noted. Electrocardiographic ECG changes were present, and chest X-ray revealed an enlarged heart. An enterovirus was isolated from a stool specimen. Which of the following is the most likely agent? A. Poliovirus 3, B. Coxsackie virus A, C. Coxsackie virus B, D. Echovirus 11, E. Enterovirus 70. What is your choice? You may see these keywords. The patient was a 12-year-old girl, a teenager. She had chest pain and difficulty breathing, and was noted to have heart failure and big heart. But the virus was isolated from stool, and it's an enterovirus. You may think it's interesting. The virus may enter through GI tract, but cause heart problem. And the choices actually are the species of enteroviruses. Enteroviruses include poliovirus, Coxsackie virus, enteric cytopathogenic human orphan virus, ECHO, and the new enterovirus, EV. Coxsackie viruses are named after the town of Coxsackie, where they were first isolated. The name echovirus is derived from enteric cytopathic human orphan virus. Can you guess why we call a virus an orphan virus? Another orphan virus is a real virus. The O in the middle also refers to orphan. The orphan tells us that the disease associated with these agents was not initially known. At least 90 serotypes of human enteroviruses exist and are classified as polioviruses, Coxsackie viruses A and B, echoviruses, or for the more recently discovered viruses as numbered enteroviruses. For example, enterovirus 71. At the beginning, the viruses were identified by the properties of infecting newborn mice, monkey, or cultivating cells of monkey and humans. If the viruses can infect monkey and cultivating cells, the viruses are polioviruses. And if the viruses only infect newborn mice, they are Coxsackie viruses. If the viruses only infect cells, they are echoviruses. Since 1969, new enterovirus types have been assigned as number. Before we leave this slide, I just want to point out there are 3 serotypes of polioviruses: poliovirus type 1, 2, and 3. Diseases caused by the enteroviruses. Several different disease syndromes may be caused by a specific serotype of enterovirus. Likewise, several different serotypes may cause the same disease, depending on the target tissues. Diseases include poliomyelitis. The polio means gray, myelo means spinal cord, and itis means inflammation. So the disease is inflammation of the gray matter of the spinal cord. We will discuss poliomyelitis in detail later. Another disease is caused by enterovirus. The boy presents with oral ulcers, vascular rash on the hands and feet. What disease? Yes, hand, foot, and mouth disease, HFMD. The disease could be caused by Coxsackie A16 and EV71. Herpangina is a severe febrile pharyngitis and is caused by several types of Coxsackie virus A. Coxsackie virus A is associated with diseases involving vascular lesions. The disease is self-limiting and requires only symptomatic management. Aseptic meningitis. Almost all types of enteroviruses can cause viral aseptic meningitis. Common symptoms are fever, malaise, headache, nausea, and abdominal pain. The disease could be fatal. Cardiac and muscular disease. Coxsackie virus B, B for body, is most frequently associated with pleurodenia and myocarditis. Pleurodenia is an acute illness in which patients have a sudden onset of fever and stabbing chest pain due to the inflammation of the pleura. The disease is self-limiting and the recovery is complete. Myocarditis is an acute inflammation of the heart and pericarditis caused by Coxsackie virus B. Ocular, acute hemorrhagic conjunctivitis. Enterovirus 70 and a variant of Coxsackie virus A24 have been associated with the extremely contagious ocular disease, acute hemorrhagic conjunctivitis. The disease has a 24-hour incubation period and resolves within 1 or 2 weeks. Respiratory infections, fever, rash, and common cold-like symptoms may occur in patients infected with echoviruses or Coxsackie viruses. Coxsackie viruses A21 and A24 and echoviruses 11 and 20 can cause rhinovirus-like symptoms resembling the common cold. Coxsackie virus B infections of the beta cells of the pancreas are the major cause of type 1 insulin-dependent diabetes. As a result of immune destruction of the islets of Langerhans. Pathogenesis of enterovirus infections. Contrary to their name, enteroviruses do not usually cause enteric disease, but they do replicate within and are transmitted by fecal oral route. The viruses are acquired through mouth, then infect intestine. Viremia virus in bloodstream spreads the virus to different target tissues. Then the enteroviruses cause diseases of the central nervous system, conjunctivitis, mucous membranes, and upper and lower respiratory tract. Also, diseases of skin, heart, and muscles. Then, virus excrete from stool. Please note, although they may initiate infection in the gastrointestinal tract, the enteroviruses rarely cause enteric disease. Let's have a break. We will discuss about poliovirus infection when we come back.